The following program on PBS 39 is made possible in part by
The Eye Center of Fort Wayne is devoted to eye care. Dr. Rex Parent, along with medical optometrists James French, Paul Gill, and Gregory Zink, specialize in medical and surgical eye care. For refractive treatment, the Eye Center of Fort Wayne utilizes technology such as Bausch & Lomb custom LASIK and multifocal refractive lens exchange. More information is available at 424-5656 or drparent.com.
And good evening. Thank you so much for watching HealthLine here on PBS 39 HD. I'm your host, Mark Evans. Another colorful show with Dr. J. Rex Parent as we have our Vision Care series going on tonight. And we're going to talk specifically about glaucoma and cataracts. And we also have a very special guest who recently had eye surgery, a refractive lens exchange. And she's going to answer your questions as well. Any other eye concerns, Dr. J. Rex Parent will always answer those questions for you. So call us. The number is on the screen. 969-2720 is the local number. And of course, we have a long distance telephone number as well, and that's 866-969-2720. We'll take your calls for the next half hour. This is a 30-minute program. We do not stop down for commercial breaks because it's public television. And Dr. Parent, great to have you. Wow, look at this, a burst of red. What's the occasion?
Well, we're here to celebrate the season, and I'm also here to celebrate the resurrection of the Hoosier basketball team.
That's right.
And particularly this is Jim Kelly, a friend of mine who's passed away. It's his original hat.
How about that?
And I appreciate Jim Kelly. In fact, this happens to be his daughter-in-law.
Oh.
So I want to know that the Hoosier team makes us pertinent again.
Yes, absolutely.
One shot made us pertinent.
And you always dress for the occasion, and a little bit of Christmas going on there, and also the Hoosiers. And that was some game the other night, I'm
Tremendous
sure.
game. A lot of fun.
That elated you. All right, well, our special guest is Patty Kelly, and she just recently had refractive lens exchange surgery, and we've had other testimonials on the air as well. And we're going to find out more about what that surgery is and find out about your experience, because you had both eyes done recently, and one was done just a little over a week ago. So we'd love to find out how that turned out and how you're seeing things now. So we'll get to you in just a moment. Dr. Parent, we want to start with cataracts because I understand from my research more than 20 million adults in the United States have developed cataracts, making it actually the #1 cause of poor vision, and those numbers are expected to increase to over 30 million by the year 2020.
Yes.
Why these increases?
Well, aging population primarily.
Okay.
The second thing is diabetes is becoming more prevalent, and cataracts are associated with diabetes. So diabetes itself causes a type of cataract called a posterior subcapsular cataract, which is literally like frost on your windshield. And you know, people don't understand until they start driving into bright light, and it diminishes their vision real quickly, and they have quite a lot of difficulty. But the main thing is aging. Just the population's aging. And, you know, UV light, also a lot of people are out in UV light a lot. I really think wearing sunglasses may be beneficial to diminish cataracts and macular degeneration. Yeah. Worldwide, cataracts are by far the biggest cause of diminution of vision. But when you talk about vision in the U.S., the most complicated thing is probably macular degeneration this time as the population age. Their macula, which is like their film in their camera, becomes disorganized and difficult to see.
And as far as cataracts, who's most at risk? Are we talking about the aged, or can young people get them too?
No, actually, I just yesterday did a young man who was 10 years old, and he had trauma to his eye and had some retina problems related to that, and we did him essentially under local anesthesia. He did great, and I'll say hypogemic, and he literally was an excellent patient. And you know, you can get it from trauma, you can get it from inflammation, you can get it from a disease called retinitis pigmentosa, but the most common cause of cataract is just aging and probably UV light exposure.
And can you be born with cataracts?
Absolutely. Yeah, there are congenital cataracts, and those cataracts are different from all other cataracts. But people are born with cataracts, and the best thing to do with people that are real young and born with cataracts is to remove them relatively quickly. And so, you know, it's a concern, but on the other hand, most people go their lives and don't have cataract surgery. So,
Right. And you can only do one eye at a time usually. Is
well,
that right?
there are places that do one eye, change the room totally, or go to another room and do the second eye. But you know, in America, if you got in a car wreck on the way home and took a risk like that, I just don't know that we're at that point yet. I'm not saying we aren't, because in this city, I'm probably the first person that ever did outpatient cataract surgery. And for example, when Patty came in, she literally walked in, had the surgery, sat down, had the surgery, and walked home. You know, not all the way home, but she walked out to the car.
And it used to be much more of a radical process before the new surgery came along, which we're going to talk about in a second. But the old way of taking care of cataracts was what?
Well, the old way, we made about a 180-degree incision around the cornea of the eye, or the clear front window. With a large incision, we had to put sutures in. In the new way, Mike McFarland, who's a personal friend of mine, actually invented no-stitch cataract surgery. We had small cataract surgery, but we still use sutures. But Mike McFarland figured out that if you make the incision exactly perfectly, it'll self-seal. And you don't need sutures, therefore you don't distort the cornea and increase astigmatism.
Very good. And Patty, we're going to talk to you in just a moment about your experience in that surgery. But first we have to go to a phone call, and we do encourage phone calls on HealthLine. Looks like Kimberly is on the line. Kimberly, your question for Dr. Parent, please.
Actually, I didn't have a question. I called to just say thank you. You did surgery on my husband, Daniel Campos, yesterday. And today we came in and had his patch removed, and he can see 20/20. And we just wanted to say thank you.
Oh, well, thank you very much for that emotional call. We appreciate that.
Thanks for the call, Kimberly.
Let's go ahead and segue to your patient, Patty Kelly here. Patty, tell us about why you needed surgery.
Actually, I didn't know I needed surgery. I went in with my husband, and he was looking into it. He had talked to Rex about it, and so then Rex kind of talked to me a little bit about it, and a week later I was having surgery done.
Wow.
At the request of her husband.
And how bad were Patty's eyes? Did she?
Well, she had moderate cataracts, not real significant.
But they would have gotten worse.
Yeah, oh, well, they do, you know, but you can never say the rate that they'll progress. The other thing, she was farsighted, and Patty loves to do things up near, and had difficulty with those, so it was a big benefit for her. In fact, as I recall, her husband told me that on the way home she looked around and goes, "Oh, look at that. Oh, look at that."
What were the struggles that you had before you had this surgery? What were the things that you could not see, or some of the experiences?
Well, I couldn't read. Reading was impossible. I couldn't see at all, and I knit a lot, so I couldn't knit. And then as it progressed, I was having a harder time seeing further away also. You know, especially at nighttime, a lot of things were blurry.
And did you wear glasses before?
I just wore readers.
Okay. And about the experience, we're going to talk about the surgery itself, but how was the experience for you? I mean, were you scared at all, or because of Dr. Parent's demeanor? I mean, were you at ease? How did that work out for you?
I was really nervous nervous the first day. You know, I really didn't even want to do it, but the more I talked about it, the more I thought, oh, if I could see, this would be so awesome.
Right.
So I was really nervous. When it was time for the second eye, I could not wait. I was so ready to go in there and get the other one done, because I could see with my left eye already.
Right.
And it's awesome. It's the best thing I've ever done.
Well, tell us about the surgery and the experience. What did you experience?
Well, just nothing.
How long did it take for each eye?
I think we were there 4 or 5 hours.
Total? Mm-hmm.
Yeah. The surgery itself didn't take very long. You go under a little anesthesia. And then the surgery's pretty quick, and then, I mean, after my second eye went home, we're moving. I packed the rest of the night.
Wow, that's just amazing.
I mean, I could see fine. It's incredible. It was so awesome.
Well, let's talk to Dr. Parent about that procedure. Exactly what did you do for Patty here?
Well, what we did was, in fact, we've got some, I think if we can pull up number 7, we can talk about what a cataract actually is.
All right.
And a lot of people don't know what a cataract is. They think it's a growth on the eye, or they think it's something else. But a cataract, there's a lens in your eye just like a lens in the camera. And a cataract is actually a cloudy lens. And so when the lens becomes cloudy, your vision becomes a little blurry. You can't accommodate as well. You have difficulty seeing at distance like she did, and up near. And when we remove the cataract, the big technique that's changed is Charles Kellman, who was an individual in New York, was trying to figure a way to make cataract surgery better. When we talked about it before, I told you that they literally used to make a 180-degree incision around the eye. We put sutures in the eye. They had to lay still, all these different things they couldn't lift. And just like Patty said, she went home and started lifting and just working it, moving.
Right.
And Charles Kelman was thinking about this time and time again, and he invented an ultrasound machine that actually has a vibrating tip that breaks up the cataract, and then the center of the tip is hollow, and it sucks the broken up material out.
As a matter of fact, if
it's
we
called
go to
ultrasound,
slide number 8,
that's
yeah,
correct.
we can see that.
Slide number 8 will show us that. And then after we remove that cataract, which is like in a little baggie or like a little saran wrap type material, then if we look at number 9, we then take a foldable lens and we put that foldable lens through that tiny incision. It opens inside the eye like a butterfly opening its wings. And if we look at number 10, you can see the lens actually positioned in the eye. So that's the primary thing. When it opens its arms into this little capsule bag, which is like saran wrap. And the big thing that makes this a very good procedure is that there are no vessels in this capsular bag. It is just like saran wrap. And therefore, you don't get an immune response, and you don't get inflammation.
All right, and then you said that on slide number 9, I did notice those little wings there. Are those there to pretty much lock that lens in?
That's
keep
exactly
it from floating
correct.
Around? Oh, okay.
Those are called haptics. They're little arms that hold it in position, and the center is an optic, just like an optic in any lens, in your glasses or in a camera or whatever.
Now, she mentioned that she was pretty much there at the office for 4 to 5 hours.
Yeah,
but
the
how
main
long
reason the main reason they're there early is we do have them start antibiotics and some specific medicines ahead, but some people forget those, and it's been found that if you give it in the office and have an hour or 2 or 3 for the antibiotics to work, your rate of infection and reaction after surgery is markedly diminished.
So you're not on the table for 4 or 5 hours. How long is the procedure?
No, actually, her husband was selling cars for about 2 hours.
Okay, all right. So it's just about an hour and a half, 2 hours on the table then.
Well, on the table, no, maybe 15 minutes.
Oh, wow.
20 minutes.
That's
very,
even
very
better.
little time.
Yeah.
I would say from 5 minutes to 20 minutes, but certain people have complicated cataracts or injuries and things. It just takes longer. But it varies with every single patient. And but most patients that do very well now. She didn't have any injection other than topical drops and anesthesia. We gave her a little IV medication, and Patty just did very, very well.
I had a grandmother, God rest her soul, but she passed away in the 70s, but 10 years before she actually passed away, she was legally blind because of cataracts, and she didn't want to go through the procedure, the old procedure, and she would have just benefited so much with this new procedure. And she was a sewer, and she loved to cook, but she just had to give all that up. Because it was just so much of a radical surgery, and I think back then it was not a guarantee that it was even going to work.
No, it was a lot more risky. The risk today in the hands of a real good surgeon is very, very minute.
Wow, it just sounds amazing.